Hi, my name's Colin. I'm going to be doing, is it okay if I do your physical assessment this afternoon?
Yes.
All right, thank you. Nice to meet you.
Nice to meet you too.
Okay. So the first thing we'll do is inspect the patient's general appearance. Good posture, good hygiene. Skin is normal color for ethnicity. Bone structure and muscles seem symmetrical at this point. So health history and vital signs have already been taken. So we will begin with the assessment. So first we're going to inspect the head and the face. So first we'll do a normal inspection. Upon appearance, there doesn't look like to be any abnormalities. We will palpate throughout the scalp, checking for masses, lesions. We'll inspect as well. Hair distribution all seems normal. No tenderness upon palpation. Face is symmetrical. Next, we will have the patient move through a series of facial movements. Can you wrinkle your forehead? Can you open very wide? Good. Can you blow your cheeks out? Can you open your mouth? Can you smile? Can you clench your teeth? Okay. Can you try to open your jaw? We will palpate the TMJ. Can you move your jaw open and shut? And can you move it left to right? Can you clench down? Do you feel any pain?
No.
Good. Okay. We will move on to the temporal arteries. We'll palpate. There's a palpable pulse bilaterally. Next, we'll move on to the mouth. So I'll have you open your mouth, please. Can you move your tongue from side to side? It appears midline. The tongue is pink. The oral mucosa is moist. Can you show me your gums? No receding, no bleeding, no discharge. Okay, can you open wide? I'll have you say ah. Uvula is midline and reactive. The palpate is as well. Tonsils are visible, not touching. The teeth appear to be in good hygiene with no missing teeth, no dentures. Good. All right. Next, we'll inspect the eyes. So initial inspection, there is nothing abnormal about the eyes or the structure. Is it okay if I pull your eyelids down? We'll inspect the conjunctiva, upper and lower, the inner and outer canthus of the eye, the iris, sclera, and the pupils appear to be equal bilaterally. I'm going to shine a light in if that's okay with you. So we're checking for a pupillary light reflex. Good. And the pupils are equal, round, and reactive to light. I'm going to have you follow the pen light if you can. We're going to test your extraocular movements. Good. Okay. Next, we will test visual acuity. So I'm going to take what would be a Snellen chart. I'll stand 20 feet away and I'll have you read the lowest line that you possibly can, please.
I can see the second line from the bottom. It says KLRSTNO.
Good. All right. Vision acuity appears to be 20/20. Next, we will test confrontation. So I'm going to test your peripheral vision. You tell me when you see the object come into your peripheral vision.
Now.
Okay.
Now.
Good. Seems to be within normal findings. So next we will inspect the ears. So the external ear structure appears to be in good alignment with the face. Structures all appear normal. No discharge, drainage, redness, or swelling on the left ear or the right. I'm going to perform the whisper test. So I'm going to whisper a word into each ear, and I want you to repeat the word that I speak.
Broccoli.
Yep.
Cinnamon.
Good. Okay, whisper test is good. Next, we will palpate the pinna on each side, and we'll palpate the tragus. Any Any pain, any
No pain.
tenderness? Good. Okay. Following this, we will inspect the nose. The nose appears symmetrical upon inspection. Midline, no drainage, no discharge. Septum is midline as well. The nose has fine hair throughout, which is normal. We'll test the patency of each nostril. Can you blow in and out through your nose? Good. Good. No obstructions, no issues with the nose as well. We'll move on to the neck. So anterior neck appears to be symmetrical as well. There are no lumps or masses. We'll gently palpate. We'll palpate the cervical lymph nodes. They feel small and nodular with no tenderness. The trachea is also midline with no masses, no tenderness. We'll palpate the carotid arteries one at a time. Good. Palpable on the left and the right. And we'll auscultate for bruit. There is positive brewing each side with no thrill. Next, I'll have the patient turn around, if you can, sit right here. We will assess the posterior neck. And what we're feeling for is the thyroid gland, which I'll have you lift your neck up if you can, please. The thyroid is palpable. It's not enlarged, not tender. And I'll have you swallow, please. Good. Then the posterior approach and palpation of the thyroid gland appears normal. Okay. I will have you sit back down forward. Next, we'll test range of motion and strength. I'll have you turn your head towards your shoulder and the other way. Back, flex. Good. And rotate left and right. Good. And we'll test these motions again against resistance. Good. Good. Rotate. Good. Good. No deficits in the strength or range of motion. Next, we have already inspected the gag reflex, and there is a positive reflex. The patient was compliant with this test, so we will not check that at this time. So next, we will inspect the thorax and lungs from a posterior approach. I'm sorry, I'll have you turn back around if you can.
Right here, okay?
Yeah, that's good. Okay, so first we'll check out the symmetry, the muscles and the bone structure. We will gently palpate as well. Upon inspection, there is nothing abnormal. The spine is in good alignment. We will also palpate the spinous processes. Any pain or tenderness?
None.
Good. No masses, no palpable abnormalities. The skin appears normal with no lesions. Skin temperature is good. All right. Next, I'm going to assess the respiratory and thoracic expansion. So I'm going to keep my hands right underneath the thoracic cage, subscapular, and have the patient breathe in. And again. Good. And the hands rise and fall symmetrically. There is nothing abnormal about this as well. Next, we will percuss for the CVA, or costovertebral angle, for tenderness, which could be indication that there is an infection or some sort of pathology of the kidney. So I'm going to place my hand. Is it okay if I tap gently?
Yep.
Any tenderness?
No.
Any tenderness?
No.
Good. Okay. So now, while we're here, we'll also assess the auscultation of the breath sound. So we'll auscultate over 5 different fields, starting with the RCs. And I'll have you breathe in. The apices, excuse me. Good. Okay, the apices of the lungs have bronchovesicular breath sounds. The lower lobes have vesicular breath sounds upon auscultation, which are normal findings. Vesicular sounds throughout the lateral lobes as well bilaterally. There are no adventitious breath sounds, no accessory breathing muscles activated with breathing. The breath sounds are clear with no crackles, wheezes, rhonchi, or adventitious sounds, as we mentioned. So those are normal findings as well. So while we're here, I'll have you switch back forward if you don't mind, please, so you can sit back over. Okay, we will assess the anterior thoracic cage. You can. That's okay. So again, the skin appears to be good temperature, good color, no lesions, masses. I will also listen on the front, on the anterior approach of the chest for breath sounds as well at the apices. Good. Okay. Again, breath sounds are normal throughout. Bronchial sounds over the trachea, bronchiovesicular in the apices, and vesicular breath sounds throughout the lower lobes of the lungs. So next we will also auscultate the heart sounds at the cardiac base. So I'll have the patient lean forward slightly, and I'm going to keep the diaphragm of the stethoscope in the fifth intercostal space, and have the patient breathe in and exhale deeply. We're assessing for a murmur, which there is none, so these are all normal findings. So, all right, next we're going to test the upper extremities. So I'll have you stick your hands out if you can with your hands facing down. Good. Bones and muscles are symmetrical. Temperature is warm. I'll check with the dorsum of my hand. It's good. Skin characteristics and color are normal throughout. We're going to check capillary refill. About 1 to 2 seconds, which is a normal response. Next, we'll test range of motion. I'll have you bring your arms up towards you, down to the floor, out to the side, up over your head, back to me. All right, and the wrists, up and down. Good. Fingers make a fist and open. Good. We'll test strength. Pull your arms up and down. Good. Pull me towards you. Push me away. Good. Lift your arms up to the ceiling and down to the floor. Good. Wrists up towards you and down. Good. Range of motion and strength are normal throughout the upper extremities. Next, we will also palpate. We've already tested for capillary refill, so we will check range of motion of the shoulders. So I'm going to have you sit upright. I'm going to have you shrug your shoulders up and down and up against resistance and down. Those are both normal responses, no tenderness or pain throughout those motions. So next we will check the neck vessels. So I'm going to have the patient lie at a 30 to 45 degree angle. So if you wouldn't mind lifting your legs up, I'll have you sit back. Good. Okay, in this position, are you comfortable?
Yeah.
I'm going to take this a little bit this way.
Okay.
So in this position, the patient is going to turn their neck side to side. I'll have you look that way. And what we're looking for is jugular venous distension, of which there is none on the right, and I'll have you look the opposite way, please. Again, no jugular venous distension. There is a pulse that you can notice, but it's not very noticeable upon inspection, but you can palpate again. That's the carotid pulse, and that's distinct from the jugular venous distension that we were assessing. So next we'll assess the heart and the anterior chest. So upon inspection, there is no, the precardium has no apparent heave, no accessory breathing, and no thrill upon palpation with breathing. All right, and we will auscultate the heart sounds. First, we will auscultate the aortic valve, which is in the second right intercostal space. Next, we'll check the pulmonic valve. Third and fourth. Mitral valve. the tricuspid, excuse me, and the mitral valve. We will also take at the apex of the heart, which is the 5th intercostal space. 3, 4. And we will assess the apical pulse and pulse rate and rhythm. Now I'll also auscultate with the diaphragm of the stethoscope for extra cardiac sounds. Throughout each of the cardiac fields, there is an audible S1 and S2. There are no extra cardiac sounds when listening with the bell of the stethoscope. You can hear all of the correct valves opening and closing throughout each sound and each field, and the pulse rate appears to just be right at 60 beats a minute. So I'm going to have the patient also lean towards the left. So I'll just have you gently lean towards the left. I'm going to listen to the apex of the heart again in the 5th intercostal space. And we're assessing for extra cardiac sounds or murmurs. Again, S1 and 2 are clearly audible with no S3 or S4, which is a normal finding for an adult. Excuse me. Okay, next we will put the head of the bed flat. And you're going to lay it on your back. Yep. Okay, so we will inspect the abdomen and the hips. So normal initial inspection appears with no noticeable pulsations, no masses, no tenderness, no lumps. Any tenderness when I palpate?
No.
Good. Okay. Next, we're going to auscultate bowel sounds in 4 quadrants. I'm sorry. Right lower quadrant. Right upper. Left upper. Left lower. There are positive bowel sounds throughout each of the 4 quadrants, which is a normal finding. After this, we will auscultate the abdominal aorta. We'll use the bell of the stethoscope for this. And there are vascular sounds throughout, but no thrill. Next, we're going to move on to percussion. Is it okay if I gently tap in each of the 4 fields? And we'll use a zigzag pattern. Any tenderness?
None.
Okay, so there is a resonance. There is no hyperresonance and no dullness, which indicate there is no fluid in the abdominal cavity, any abnormal findings. So these are normal findings as well. Next, we will proceed with palpation. So we'll start with light. Any tenderness?
None.
No palpable masses. There is a palpable organ underneath the right upper quadrant, which is the liver. There's no tenderness. Patient seems to be comfortable with this procedure. So next we will assess the hips. So in order to do this, they appear midline. Bone structure is good. I will have you bend your knee up and down. And again with the left. Good. I'm going to have you bring your leg out towards me. Abduction and adduction. Good. And we'll do all these against resistance. Can you lift your leg up and down, out to the side? Good. Out to the side. And while we're assessing the lower legs, I'll also palpate for the 4 pulses in the popliteal. We will do the dorsal pedis pulses, anterior tibialis. All those pulses are palpable. I'll test capillary refill. 1 to 2 seconds. Again, these are normal findings. So No skin discoloration. Skin temperature appears warm. There is no evidence of any kind of ischemia or occlusion of blood flow throughout the lower extremities. So I will have the patient dorsiflex. Can you point your toes up to you and down towards me? Good. And out to the side and inward. Good. And we'll do these against resistance. Good. No strength deficits. Range of motion appears to be grossly intact. So we'll inspect the toes. We already test capillary refill. Sorry. Next, we will test the Babinski reflex. The patient's ticklish, but there is no Babinski reflex, which is normal in an adult finding. That reflex would proceed with the toes fanning out, which there was no evidence of. So, good. We will also test for the neurological cerebellar function, which would include taking the heel and running it down the shin in a midline way. Yep, fashion, good. And the opposite. Good. No pulsating movements, no tremors. The patient is able to draw the heel down the shin in a straight line without any kind of falling from the midline. So those are normal findings as well. All right. Next, we will have the patient sit upright, please. I'll have you sit back on the couch if you don't mind. All right. We will test the strength of the knees. So I'm going to have you bring your knees up to you and up. And I'm going to have you kick your foot out straight towards me. Okay. And up and back. All right. Range of motion and strength appear to be intact. Excuse me. All right, so after this, we will proceed with the neurological test. So we are going to test the deep tendon reflexes in the knee. So I want you to try to let your leg relax. And I'm going to test your deep tendon reflex, okay? Good. Let it relax. Good. Okay, deep tendon reflexes are intact bilaterally. Next, we will assess for the sensation. So we will test, we're going to test the stereognosis. So in order to do this, we need a couple of extra pieces of equipment. So without having the patient see, we are going to have the patient close her eyes. First, we'll test for proprioception and where knowledge of where the patient is in space. So I'm going to take your finger and your thumb one at a time, and I'm going to point them either up and down, and I want you to tell me which direction I'm pointing them. Okay?
Up, down, up, up, down.
Good. Patient has no neurological deficits in that field. We will also test pain discrimination. So with the hand, I'm going to use the blade or the hand piece to the scissors to test for dull, and the butt end. These are actually bandage scissors, so there isn't a sharp end. But she should be able to distinguish between sharp and dull pain. So I'll have you close your eyes and tell me if this feels like a dull or sharp pain.
Dull. Sharp. Sharp. Dull.
Okay. And we'll do the same through the legs.
Dull. Sharp. Dull. Sharp.
Good. Okay, next we will test the stereognosis as we mentioned. So the patient will be able to, should be able to identify an object that is placed in the hand without seeing it. So I'll have you hold your hand out. I'm going to place an object in. I want you to feel it and try to guess what it is.
A key.
Good. Excellent. Okay. Next we will test light sensation. So I'm going to have the patient close her eyes and gently touch with, you would use a cotton ball, but in this case we're going to use a paper towel. So just say yes when you feel me touching you, okay?
Yes. 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 Yes.
Okay. Neurologically, the patient can detect light sensation with a paper towel. While we're here, we'll also touch back on one of the assessments that we may have missed initially. So we will palpate the brachial pulse. And the carotid. Excuse me, radial. And we'll also feel for the lymph nodes just below the elbow. And they're palpable, small and nodular with no tenderness. Pulses are palpable also throughout. To continue with our neurological assessment, I'm going to have you place your hands on your knees, and we're going to test your rapid alternating hand movement. So you're going to take your hands like that and tap your lap as fast as you can. Good. Neurologically intact. Okay, those are normal findings. So we will move towards the end of this assessment, and that will include a gross motor neurological exam. So we're going to have the patient stand, if you don't mind, please. And I'll have you walk to the end towards me. And turn. All right, next I'll have you walk heel to toe. Good. And on the way back, I want you to walk on your toes, please. And on the way back, on your heels. Good. Okay. Next, we'll test Romberg. I'll have you stand still. So the Romberg test is for proprioception and balance. It also tests it can test for vestibular problems. So this test is very simple. I'm just going to have you close your eyes and stand statically for 20 seconds. The patient should stand statically, like we said, with no movements, no swaying, no loss of balance, which this patient has. There is no reason to believe that there are any neurological deficits after performing these exams. So, okay. Next, while we're here, I'll have you stand up, continue to stand. And we'll test the range of motion in the spine. I'll have you flex towards me and extend backward, side to side. Good, and you'll rotate each way. Any pain, tenderness?
No.
Good. Okay, those are full range of motion. You can sit. I believe that this concludes our physiological assessment, and I want to thank you for performing the exam with us. Thanks a lot.
Thanks.